Hi, my name is Melissa, and this is my first video assignment on posture assessment. Today we'll have Tanner join us. Hi Tanner, my name is Melissa, I'm a student RMT, and today we're going to be assessing your normal standing position, so if you can try and stay as relaxed as you can throughout. The purpose of this video is to demonstrate my knowledge to my instructors, and some negative outcomes might be some mild discomfort. If I ever use too much pressure, please let me know and I can adjust. Since this does require skin-to-skin contact, do I have your consent?
Yes.
Great, and then I'll also ask for secondary consent at this time to go over your pelvis and glute region. Will that be okay?
Yes.
Great. Do you have any questions?
No.
Perfect, we can get started. So if you can look forward and stand just how you normally would in a relaxed position. I'm going to start by lining up the midline. If you can make a border here, just at your pubic bone, I can run down here until I find the pubic symphysis. And here will be the suprasternal notch of the manubrium. And here is the nasal bones creating the midline. This is a good position to assess the medial malleoli. You can see that they're at an even height. Moving up, I notice that his hands are internally rotated at the wrist. I can expect that I'll also see some internal rotation at the shoulders as well on both sides. Looks like the right is a little bit more pronounced. Can you take a quarter turn to your left? Great, and for the midline of the lateral position, I'll look anterior to the lateral malleoli. I can find the fibular head here. The greater trochanter, can you rotate your hip in and out? Great, just here. The acromion process and the external auditory meatus. From this position, we can assess the angle of the knee should be between 0 and 5 degrees. Looks normal to me. We can also look at the anterior pelvic tilt. If you can move your hand up for me. We can check here. It should be between 0 and 10 degrees anterior for males. Looks normal. And then we can check out this anterior rotation here. Again, it's a little bit more pronounced on this side here. Can you take another quarter turn to your left? Great. And for the plumb line on the posterior view, can I ask for secondary consent to go over your sacrum?
Yes.
Awesome. So here I'll just follow the ilium down to the PSIS, and medial will be S2. The C7, can you look up and down? Great. And the EOP here will create the midline. From this position, I can look at the angle of the knees here, and I can see that the popliteal fossa are even, which is great. This is also a good position to assess the elevation of the pelvis, see if anything's off. On the iliac crest here, it seems to be even. And we can also check out the scapula here. We have the inferior angle and superior up here. Again, it looks like his right side is a little bit higher on this side, consistent with his rotation. And can you turn another quarter turn for me, please? Great, and then from the lateral view again, I can look at the anterior portion of the lateral malleoli, as well as the fibular head and the greater trochanter. Can you rotate your hip again? Thank you. Acromion process here, and the external auditory meatus. Here, I'll check and see if there's any difference in the angle of the knee. Don't see any. I can also check his tilt on this side again. And I can look at his earlobe here and make sure that it lines up with his acromion process and his iliac crest. If you can turn to face forward. And that concludes our video. Thank you.
Thank you.